Hi, I'm Brian Conklin. This is for Speech 101, Dr. Grassinger's class, and I'm here to give my persuasive speech on bad coping methods. So we've all been told in health class and TV commercials that using drugs, alcohol, and smoking is bad for you. Drugs. And that's because students can be stressed out sometimes. So, stress can affect our lives in a detrimental way. So, why do people use drugs to cope? In particular, why do college students use them? I would like to present my opinion that bad coping methods can lead to addiction, and that is likely most students most students don't consider this or believe that it can happen to them. In order to better understand why people use poor coping mechanisms like smoking, alcohol, and drugs to deal with stress and feel better or feel relaxed, I'd like to explore what stress is and how it affects the body. Stress may be defined as a biological and psychological response experienced when encountering a threat that we feel we are unable to deal with. It was essential for the survival of our ancestors when faced with life-threatening situations to either fight back or flee away. We know this commonly as the fight or flight mechanism. In the 50s, an endocrinologist, Hans Seeley, identified the challenges we face in life as stress. He terms those challenges as stressors, the things that cause the stress. We have learned over the years that some stress is good stress. An example of that would be the feeling of pressure and urgency that can actually motivate a student to study hard before a test in order to succeed. However, this same feeling before a test can actually become bad stress for the student, who develops an increase in their pulse and blood pressure, I'm sweating, and headaches, sleeplessness, worry, difficulty breathing, body aches, poor concentration, and the inability to focus. Extreme stress can result in feeling nauseated, excessive sweating, and shortness of breath, which can lead to one to believe that they are having a heart attack. This is also known as a panic attack. Panic attacks are less common than the signs of stress that I mentioned previously. Having experienced this for the first time in my life recently, I can attest to how debilitating it is and frightening that a panic attack actually can be. I would wager that at least half of all college students have suffered some symptoms of stress during finals week. Moreover, perhaps throughout the entire school year. So why do people use drugs, or smoke, or use alcohol, or maybe all three together to cope with their stress? I hold the belief that some are actually trying to relax in order to succeed. Certainly not all students are using substances to obtain their scholastic success. However, there are folks who like the feeling of getting high, or who may suffer from social anxiety disorders, or who may just want to just fit in through peer pressure from their students, their fellow peer students. However, my contention is that there are students who use drugs and alcohol or smoking to seek relief from these intense stressors caused by the feel of failure, for instance. Perhaps smoking a joint may cause them to feel a little bit more relaxed. or possibly using a performance enhancement drug such as Adderall may increase their focus. How about drinking a few shots of tequila to calm their nerves? Although it's well known that nicotine is a stimulant, I've personally had friends who have told me it helps them to relax. As it turns out, there may be a scientific reason just for that. Studies have shown that taking a drag from a cigarette releases nicotine into the lungs. That we all know that, right? But what you may not know is most smokers are able to feel the effects within 7 seconds of taking the drag off their cigarette. When you take the drag off the cigarette, it releases a good feeling to the neurotransmitters in the brain, and that's through the mechanism of dopamine transmittal. And nicotine is more addictive because of this 7-second response time than any other drug known. So it's a very serious problem. Alcohol is a depressant. It bypasses the stomach and it's absorbed into the bloodstream, which then carries into the brain. And Adderall may increase a student's focus, just like drinking a few shots of tequila may calm their nerves, but it's definitely not good for you and should be avoided at all costs. Although it's well known that nicotine is a stimulant, I've personally had friends who have told, what the heck, I'm reading it again. So there's the end of my speech. I thank you for listening, and I hope you have a wonderful day.